Consider this. You wake up early in the morning, put on your best clothes, and head to the clinic for what you think is just a routine blood test, something you have done many times before. You sit patiently. The nurse ties the band around your arm, draws your blood, and you go home thinking it was simple and straightforward. A few days later, your doctor calls you in, looking at your reports with a serious face. He tells you that your cholesterol looks dangerously high, or that your sugar levels seem abnormal, or that your liver markers are elevated. Your heart sinks. You start worrying about new medications, possible diseases, or even more tests. But here's the shocking truth. Sometimes, those alarming numbers are not really about your health at all. Instead, they are caused by simple mistakes you made before the test, mistakes that millions of people, especially seniors, make without even realizing it. These small slip-ups can completely change your results, leading to wrong diagnoses, unnecessary stress, or even treatments you never needed in the first place. And when it comes to your heart and overall health, accuracy in your blood test is not just important, it can literally save your life. That is why today, I want to share with you 5 of the most important things you must never do before a blood test. Things that most heart specialists warn their senior patients about. Things that can make the difference between a false alarm and the truth about your health. The first and perhaps most common mistake is eating before a fasting blood test. Many blood tests like fasting glucose, lipid profile, and triglycerides are designed to measure what your body is doing in its natural state, without the influence of food. That is why doctors ask you to fast for 8 to 12 hours before the test. But what happens in real life? Sometimes a senior may forget, thinking one small snack won't hurt, or they might sip on a cup of tea or chew a piece of bread, thinking it's too little to make a difference. Yet even that small bite or sip can change everything. When you eat, your body begins to digest and release sugars and fats into your bloodstream. If your test is supposed to measure fasting blood sugar or cholesterol, those numbers will shoot up simply because of the meal, not because your body is sick. Imagine going to the doctor, seeing a blood sugar level that looks high, and being told you might be pre-diabetic when in fact, you just had a cookie late last night. Or imagine your triglycerides being marked as dangerously high simply because you forgot and drank a glass of milk before heading to the lab. These kinds of errors are so common that doctors often ask patients if they really fasted, because they know how often it happens. For seniors, this is even more critical, because so many medical decisions, whether to start cholesterol-lowering medication, whether to increase insulin, whether to order further scans, depend on those numbers. A false result could mean starting unnecessary drugs, living with unnecessary side effects, or on the other side, missing an actual problem because the numbers were misleading. That is why fasting really means fasting. Only water is allowed. No tea, no coffee, no juice, not even a small mint. Nothing but water. If you forget and eat something, it is better to reschedule your test than risk inaccurate results. Remember, your health deserves accuracy, not guesswork. The second mistake is something people rarely think about: drinking coffee or alcohol before the test. Many people believe a cup of black coffee on an empty stomach is harmless, even during fasting. But what they don't realize is that coffee contains caffeine, a stimulant that can raise your heart rate, increase your blood pressure, and temporarily raise your blood sugar levels. So if you drink coffee before a blood test, especially one that is checking for heart or sugar-related conditions, your results may come back looking worse than they really are. A senior might suddenly be told that their blood sugar is too high, when in fact it was just the coffee talking. And then there is alcohol. Even a glass of wine or a small drink the night before can change your liver function tests, cholesterol readings, and even blood clotting factors. Your liver is like your body's chemical factory, processing everything you drink or eat. Alcohol makes your liver work harder, And when you get a blood test the next day, your liver markers may look abnormal, leading your doctor to suspect fatty liver disease or other liver problems that you may not actually have. For seniors with heart conditions, this is a serious issue because liver and cholesterol readings are crucial in adjusting heart medications. Imagine being told your liver is in trouble simply because you had a glass of whiskey before bed. That is why most heart specialists strongly advise avoiding both coffee and alcohol before a blood test, at least for 24 hours. Stick to water. It keeps things neutral, clean, and accurate. The third mistake is something many people, especially those trying to stay fit after 60, fall into without knowing: over-exercising before a test. Now, don't get me wrong. Exercise is one of the best things you can do for your body at any age. A gentle morning walk, some light stretching, or yoga is fantastic for your circulation, your mood, and your heart. But when it comes to blood tests, timing matters. If you do a heavy workout, lifting weights, jogging long distances, or doing anything that strains your muscles, your body responds by releasing enzymes into your bloodstream. These include enzymes like creatine kinase, CK, and lactate, dehydrogenase, LDH, which are released when muscles are stressed. Here's the problem. These same enzymes are also checked in blood tests to look for heart damage, liver issues, or other conditions. So if you hit the gym hard the evening before your test, your results may show elevated enzymes, and your doctor might mistakenly think you had a heart attack or liver problem. Imagine the unnecessary fear and stress this could cause, not to mention the cascade of further tests and scans you might be sent for. For seniors who are already at higher risk for heart disease, such confusion is dangerous. That is why doctors recommend avoiding heavy physical exercise for at least 24 hours before a test. A gentle walk is fine, but skip the intense workout and let your blood reflect your true health, not the after effects of your last gym session. The fourth mistake is one that seems small but can make a big difference: not drinking enough water before a test. Dehydration thickens your blood, making it harder for the nurse to draw, which means more needle sticks and discomfort. But beyond the difficulty of drawing blood, dehydration can actually change your results. When your blood volume is low due to lack of fluids, certain markers like kidney function tests, electrolytes, and even red blood cell counts can appear higher than they really are. This can give your doctor the impression that your kidneys are struggling, or that your blood is too concentrated. For seniors, who often already struggle with hydration because of reduced thirst sensation, this is especially important. Not only does dehydration make the test experience harder, but it also leads to results that may suggest health problems that don't actually exist. That is why it is recommended to drink enough water, just plain water, not juice or coffee, before your blood test. A well-hydrated body gives the most accurate results and makes the process smoother and less painful. And finally, the fifth mistake is one of the most overlooked but potentially the most dangerous: taking certain medications or supplements without informing your doctor. Many seniors are on multiple prescriptions: blood pressure pills, diabetes medications, cholesterol drugs, and sometimes vitamins or herbal supplements. What most people don't realize is that these can all affect blood test results. For example, biotin, a popular vitamin found in many hair and nail supplements, can interfere with thyroid tests, making them look abnormal when your thyroid is actually fine. Blood pressure medications can affect kidney function readings. Even common pain relievers can change liver enzyme levels. Herbal supplements, often seen as harmless, can interact with blood clotting tests or liver markers. The problem is not that you shouldn't take your medications. You should never stop prescribed medicine without your doctor's advice, but rather that your doctor needs to know what you have taken before interpreting your results. If they don't know, they may misread your test, assuming it reflects only your health, when in fact, it reflects your medicine's influence. This is especially critical for heart patients, because blood thinners, statins, and heart medications are all commonly monitored with blood tests. So always bring a list of your medications and supplements to the lab or clinic, and let your doctor know exactly what you took and when. This simple step can prevent huge misunderstandings and protect your heart and health. So now let's bring all of this together. Before your next blood test, remember these 5 critical rules. Don't eat before a fasting test. Avoid coffee and alcohol. Don't over-exercise. Stay hydrated with plain water. And always tell your doctor about any medications or supplements you've taken. These may seem like small steps, but they make all the difference in ensuring your blood test tells the truth about your health. Think of it this way. Your blood test is like a mirror, reflecting what is going on inside your body. If you smudge the mirror with food, coffee, dehydration, or medication effects, you can't see the truth. But if you prepare properly, the mirror is clear, and your doctor can see exactly what's happening, allowing them to guide you safely and wisely. For seniors, especially those with heart concerns, accuracy is not just a matter of convenience, it is a matter of life and health. So the next time you're heading to the lab, remember these 5 don'ts. Protect the accuracy of your results, protect the wisdom of your doctor's advice, and most importantly, protect your future. Because the right numbers today can prevent the wrong treatments tomorrow, and a careful blood test today can save your heart tomorrow. Share this knowledge with your loved ones, especially those over 60, because a simple mistake can change everything. But the right preparation can give you peace of mind, clarity, and a healthier path forward.